Good morning, this is YouTube Medical University. Today I'll discuss what to avoid to lower colon cancer risk and aid early detection. I will also talk about lifestyle habits, eating habits, and the initial symptoms that appear when you develop colon cancer, so you can detect it as early as possible. And in the second half, I will explain that, in fact, it is difficult to detect colon cancer early based on symptoms alone. As a doctor who diagnoses colon cancer in outpatient clinics, I will talk about which tests I recommend for early detection. In fact, according to data from 2015, colon cancer was the most common type of cancer among Japanese people, and especially for women. Colon cancer is the leading cause of cancer-related deaths by type. Also, the incidence rate of colon cancer has been increasing year by year. One of the factors behind this is the westernization of our diet. With the rise of fast food and family restaurants making meals more convenient and tasty, colon cancer has been gradually increasing. However, please don't worry. If colon cancer is detected at stage 0 or stage 1, the 5-year survival rate exceeds 90%. Even if discovered late, surgery is often possible for colon cancer, unlike pancreatic cancer, and many cases can be cured with chemotherapy. So listen until the end to learn what symptoms may indicate colon cancer. Well, I think it's normal to feel like you just don't want to get cancer, rather than worrying about the early symptoms of cancer. There has been a lot of research on colon cancer, so we have a good understanding of the risks that make you more likely to get it. When it comes to cancer, the concept of pre-disease is very important. It's crucial to reduce your risk before you actually get sick in order to lower your chances of developing cancer. Hospitals make money by treating illnesses, so they don't profit just because a disease was prevented. That's why knowledge about preventive medicine like this still hasn't become widespread among the general public. At YouTube Medical University, we clearly and responsibly share methods for preventing diseases at the pre-disease stage based on data, so please, subscribe to the channel to catch new information. And at the end of this video, I will introduce 2 lifestyle and dietary habits that can help reduce your risk of cancer. It's well known that tobacco increases the risk of all kinds of cancer, but when people who smoke quit smoking, whether their cancer risk actually decreases is another story. There are many behaviors that can increase the risk of cancer, but there is very little data showing that taking certain actions will actually lower your cancer risk. At the end of this video, I'll introduce 2 lifestyle habits that can lower your cancer risk, so I hope you stay to hear them. Now, here is the table of contents. First, in the first section, I'll briefly explain the role of the colon. In the second section, I'll talk about 4 initial symptoms of colon cancer and explain the symptoms you should watch out for. In the third section, I'll introduce 9 key risks of colon cancer and discuss the characteristics of people who are more likely to develop it. And in the fourth section, I'll briefly explain what kinds of tests are available to detect colon cancer early and treat it. And in the fifth section, let's get a general idea of what kinds of treatments are currently being used for colon cancer. And finally, in the sixth section, I'll talk about behaviors that have been reported to lower the risk of colon cancer. I've carefully selected 2 of them to introduce to you. I'd be happy if you could listen to this multiple times or take notes as you listen. Now let's start by reviewing the role of the colon. The colon is the part of the digestive tract closest to the anus. The nutrients you take in through your mouth pass through the stomach and small intestine and eventually reach the colon. This thick tube is the colon, and it's said to be about 1.5 to 2 meters long. That's surprisingly long, isn't it? So what does it do? Its roles include absorbing nutrients and water. While most nutrients are absorbed in the small intestine, water is not easily absorbed there. The food that moves from the small intestine to the colon gradually loses water and becomes solid, forming stool. So at this stage, the stool is still soft, but by the time it reaches the end, near the anus, it becomes firm. It's said that the colon can absorb up to 6 liters of water a day. That's pretty impressive, isn't it? And in hospitals, they also use specialized terms, so to explain the technical terminology, it's divided into the colon and the rectum. The rectum is located near the anus, and the colon is divided into 3 parts. There's the ascending colon that goes upward, the transverse colon that goes across, and the descending colon that goes downward. Also, the part that curves in an S shape between the rectum and the colon is called the sigmoid colon. These parts together are called the large intestine, so cancer in any part is usually called colon cancer. It's important to know that stool remains soft in the ascending colon, which is key to recognizing early symptoms. Now, for the second point, to detect colon cancer early, what kind of symptoms appear when cancer develops? There are many YouTube videos titled Early Symptoms of Colon Cancer, but in reality, there are no early symptoms of colon cancer. There are no early symptoms. This is clearly stated in the guidelines as well. So, what I'll be discussing this time are the initial symptoms. I'll explain what kinds of symptoms occur when colon cancer has grown to a certain size. Let me repeat, even at the stage of initial symptoms, colon cancer can sometimes be treated with surgery, and it is a cancer that can be cured with chemotherapy. So please listen with hope. Here are 4 initial symptoms of colon cancer. The first one is having thin stools. This is an image from a colonoscopy. Colon cancer grows inside the colon, causing the inner space to become narrower. Because of that, the passage for stool becomes narrower, so the stool itself becomes thin. However, as I mentioned earlier, stools become harder in the latter part of the colon. So, when cancer develops here, the stool itself is still soft and can pass through, and it forms a mass here, so the stool does not become thin. Stool becomes thin when a tumor forms in the end of the colon. Understanding the colon's functions can help you predict symptoms. What I want you to be careful about is not to worry that you have colon cancer just because your stool is thin only once. Everyone has variations in stool size, so unless your stool is clearly thinner than before, it's getting thinner, it's consistently thin, or it's gradually becoming thinner. If you notice these kinds of changes, there is a possibility of colon cancer, so please consider visiting a hospital. The second initial symptom of colon cancer is constipation. As you may have understood from previous videos, cancer tends to narrow the inside of the colon. Because of this, bowel movements can become worse, leading to a tendency for constipation. Other factors include the fact that as colon cancer grows inside the colon, it becomes harder for the colon to move, making it more difficult to pass stool. Also, inflammation caused by colon cancer can slow down the movement of our abdomen. Because of this, colon cancer can also lead to constipation. Of course, constipation is a very common symptom, so it's not always easy to identify. If you have constipation that doesn't improve or keeps getting worse, it might be a good idea to keep colon cancer in the back of your mind as a possible cause. The third initial symptom of colon cancer is this: anemia. You might be wondering why colon cancer causes anemia. Almost all cancers have a characteristic called neovascularization. Let's say this is the passage where stool goes through and colon cancer starts growing rapidly. When that happens, the cancer develops new blood vessels called neovascularization, and these blood vessels start growing rapidly inside the tumor. Our blood vessels are made by DNA and are constructed very precisely so they don't bleed easily. However, the temporary blood vessels formed by cancer are fragile, and when stool passes through or the colon moves, they are easily stimulated and tend to bleed. As a result, gradual bleeding from colon cancer can lead to anemia. And the troublesome thing about this anemia is that it continues gradually and persistently. For example, unlike hemorrhoids where blood gushes out and turns the toilet bowl bright red, with colon cancer, the bleeding is usually gradual and not noticeable in the color of the stool. When I was seeing patients in the outpatient clinic, a 70-year-old man came in complaining that he had been feeling short of breath lately. His face was completely pale, so I thought he might be anemic and did a blood test. The hemoglobin level, which is normally above 10, was only 4 for him. Thinking something was wrong, I investigated further, and as a result, colon cancer was found, so it gradually progressed. Anemia. The important symptoms of anemia are fatigue, shortness of breath, and what we call facial pallor, where the face becomes pale. If you have these symptoms, please consider visiting a hospital. The fourth initial symptom of colon cancer is bloody stool. As I just mentioned, colon cancer can cause bleeding. This bleeding is often hard to notice, but if the bleeding is from the latter part of the colon, closer to the rectum, you may see bright red blood mixed with your stool. What to consider when you see red blood mixed in your stool? One of the possible diseases is colon cancer. Of course, there are other causes as well, such as hemorrhoids, or something called colonic diverticulum, where a small pouch forms in the colon and bleeding occurs from there, known as diverticular bleeding. And are you aware of the sign where your stool turns black? Many people who are knowledgeable about health may already know this. In fact, with colon cancer, having black stool can sometimes be a sign of bleeding. Some other YouTube videos haven't explained this or have given slightly incorrect information, but actually, even if the bleeding comes from the colon, the blood can oxidize, turn black, and come out in your stool. Please remember that our blood is red if it comes out right away, but if it stays inside the body for a long time, it oxidizes and turns black. and that black color is as dark as this stethoscope. To explain in more detail, when blood comes into contact with digestive fluids or stomach acid, the red blood turns black. So if your stool is black, it could be a sign of colon cancer, but more commonly, black stool can also result from bleeding due to stomach ulcers, gastritis, or bleeding from the esophagus. Whether or not cancer is present, having black stool is a very dangerous situation, so if you notice it, I strongly recommend that you go to the hospital without waiting even a single day. Now I will explain 5 risk factors for colon cancer. Here is the first of the 9 main risks for colon cancer. Red meat and processed meat. Red meat refers to meats that are red in color, such as beef and pork. Chicken is considered white meat, so it is not included. Meat is an important source of protein, essential amino acids, and vitamin B12. These important nutrients are abundant in meat, but there is data showing that processed meats made from these meats increase the risk of colon cancer. And it's not just colon cancer. When it comes to red meat, it's also said to increase the risk of stroke, breast cancer, heart diseases like myocardial infarction, and prostate cancer. And in addition to the risks I just mentioned, there is data showing that processed meats also make you more susceptible to pancreatic cancer and diabetes. That doesn't mean I'm telling you to never eat them. I also eat meat regularly. What's important is not to take that data at face value, but to understand how many grams become dangerous and why they're dangerous. For red meat, it's said that eating more than 100 grams a day may increase the risk of colon cancer. And for processed meat, there's data showing that just 50 grams a day can raise the risk of colon cancer. In terms of data quality, you can be almost certain that processed meats increase these risks. For example, a hamburger steak at a restaurant is about 150 grams per serving, so 50 grams of processed meat is actually quite a small amount. On the other hand, if you stay below these amounts, there isn't clear data showing a significant increase in risk. So just because some videos say red meat is bad, you shouldn't blindly avoid eating it. Because there's so much information out there, it's easy to pick up incorrect information, so it's important to remember why something is considered dangerous. The reasons processed meat is risky are additives and salt content. In particular, nitrites, which are used as preservatives, are being closely watched because they may actually have harmful effects on the human body. It's said that these preservatives can cause inflammation in the body, which increases the risk of cancer. Also, processed meats tend to have a lot of salt, and consuming too much salt can lead to high blood pressure, which raises the risk of stroke and heart attack. So, it's not that all processed meats are bad. If the preservatives and salt content are low, they might actually be safe. Don't just blindly believe everything. Try to understand why something is considered bad. In the end, I hope you'll be able to judge for yourself whether something is healthy and whether what someone is saying makes sense. At YouTube Medical University, we share information like this, so I'd be happy if we could learn together. And as for why even red meat that isn't processed can be a risk, it's said that red meat can cause constipation and tends to increase the number of less beneficial anaerobic bacteria in the gut. In other words, it's believed that constipation or an imbalance in gut bacteria can lead to an increased risk of colon cancer. Here's the second of the 9 colon cancer risk factors. It's lack of exercise. When you don't get enough exercise, you're more likely to become constipated. As I mentioned earlier, constipation is one of the possible causes that can increase the risk of colon cancer. So, if you don't get enough exercise, your bowel movements slow down, making you more prone to constipation. It's said that your risk of colon cancer may increase. The third of the 9 main risks for colon cancer is obesity. It's said that people with a body mass index of 25 or higher have an increased risk of colon cancer. Body mass index is calculated by dividing your weight by your height twice. So for someone who is 160 centimeters tall and weighs 50 kilograms, you would convert 160 centimeters to meters, which is 1.6, then divide 50 by 1.6, and then again by 1.6 to get the value. If that value exceeds 25, it becomes a risk factor for colon cancer. The fourth of the 9 main risks for colon cancer is excessive drinking. As for what counts as excessive drinking, it's about 1 large bottle of beer or 1 serving of sake. For wine, drinking 2 glasses a day increases the risk of colon cancer for both men and women. According to one study, the risk of colon cancer increased by 1.4 times. In addition, alcohol can cause various other It can also increase the risk of oral cancer, cancer inside the mouth, pharyngeal cancer, cancer of the throat, esophageal cancer, cancer of the esophagus, as well as liver cancer and colon cancer. You should be especially careful if you are the type of person whose face turns bright red when you drink alcohol. People like this, without going into too much detail, have difficulty metabolizing alcohol. Acetaldehyde can build up in the body and raise the risk of esophageal cancer, so if your face turns red when you drink alcohol, be especially cautious. The fifth risk factor for colorectal cancer is smoking. Like alcohol, smoking increases the risk of all kinds of cancer. The reason is simple. Tobacco contains carcinogenic substances. Smoking increases the risk of various cancers such as lung cancer, stomach cancer, and colorectal cancer. And while it can also reduce lung function, there is also data showing that quitting smoking at any age shows that lung function can slowly improve, so it's never too late to consider cutting back or quitting smoking at any age. Of course, if you really love smoking and it's one of your joys in life, and you don't want to live longer if it means giving up that pleasure, I don't think you necessarily have to quit. So please have an open and honest conversation with your primary doctor about your life and make your decision together. The sixth risk factor for colon cancer is aging. The risk of colon cancer increases sharply after the age of 50, and this rising risk continues all the way until the age of 80. Because of this, colon cancer screening is recommended for people over 40. After all, no one can avoid getting older. For these reasons, getting cancer screenings when you reach the recommended age is a very reasonable thing to do. This applies to most types of cancer, so please keep in mind that the older you get, the more you need to be careful about cancer. Here is the seventh of the 9 risks for colorectal cancer. It's genetics. In fact, about 30% of colorectal cancer cases are thought to be caused by genetic factors. So, if 3 people develop colorectal cancer, about 1 of them is likely due to genetics, especially for those with a condition called familial adenomatous polyposis or familial adenomatous polyposis. About 50% develop colorectal cancer in their 40s and about 90% develop it in their 60s. I think it's surprising that 90% develop it in their 60s. Because of this, if you have a family member with colorectal cancer, I strongly encourage you to consider the screening tests that I'll explain next. Here is the 8th of the 9 major risk factors for colorectal cancer. People who have had colorectal cancer before. Many of you might think this is obvious. However, after undergoing treatment for colorectal cancer and believing you're cured, it's natural to feel relieved. Some people don't go for follow-up examinations afterward. I have patients in my clinic who had colorectal cancer and before they knew it, stopped going to the hospital where they had their surgery. However, compared to people who have never had colorectal cancer, those who have had it before are at a higher risk of recurrence. For these reasons, hospitals where surgery was performed conduct regular follow-ups every 6 months or once a year. If you or someone you know is undergoing follow-up, please understand that these tests are not being done blindly, so I encourage you to consider regular checkups. Here is the 9th and final risk factor for colorectal cancer. It is having a dangerous underlying disease. Former Japanese Prime Minister Shinzo Abe also actually suffered from ulcerative colitis, which is a disease that carries a high risk of developing colorectal cancer. For people who have developed ulcerative colitis, this is a Western statistic, but about 8% of them developed colorectal cancer after 20 years. And looking at 30 years, about twice that number, around 18% of people developed colorectal cancer. That's not all. In fact, people with diabetes, which is much more common, are said to have a 1.3 times higher risk of colorectal cancer compared to those without diabetes. People with diabetes are known to have a higher risk of vascular problems, but actually their risk of malignant tumors also increases. If you have any of these conditions, it's important not to be overly fearful, but to regularly consult with your primary doctor and undergo routine checkups. Let's review the 3rd period. Here are 9 risk factors for colorectal cancer. 1st, red meat and processed meat. 2nd, lack of exercise. 3rd, obesity. 4th, alcohol. 5th, smoking. 6th, aging. 7th, genetics. 8th, history of treatment. 9th, underlying medical conditions. There are a lot of risk factors, so it might be hard to remember them all, but I'd be happy if you could take notes or review them. As for tests to detect colorectal cancer early, there are various tests such as colonoscopy, stool tests used in colorectal cancer screening, also known as fecal occult blood tests, as well as colon computed tomography and barium enema examinations. If you ask which of these is the most important test, it's the one where you can actually see with a camera. I think it's the colonoscopy. A colonoscopy is a test where a camera is inserted through the rectum to directly check for colorectal cancer or polyps. However, as those who have experienced it probably know, this test is really tough. You have to drink a laxative to completely empty your stomach. So drinking a large amount of laxative is tough, and after that your stomach hurts and you have a lot of bowel movements. That's also really tough, but because it's so tough, it's also a very effective test. And for some people, inserting the camera from the rectum can be quite painful, and there are patients who say they never want to go through it again. But because it's so tough, this colonoscopy is, after all, the most important test. It's even said that just having a colonoscopy once can reduce your risk of colon cancer for the next 10 years. However, I sometimes get asked, how often should I have a colonoscopy for colon cancer? At present, there is no set interval for how often you should have it. I think it's important to decide the timing together with your primary doctor based on your individual risk. And as a recommended test before undergoing such a tough colonoscopy is the fecal occult blood test, or stool test. It requires collecting a stool sample with this kit and submitting it for examination. Generally, it's done over 2 consecutive days, and if there's even a small amount of fresh blood mixed in, the result is considered positive. But I've heard that this test can come back positive even if you just have hemorrhoids, and it can also be positive if you have polyps. Doesn't that mean it's not that effective for detecting colon cancer? I hear that a lot, but this fecal occult blood test is actually a very important test. To support that, one of the tests that can be done at public expense in Japan is this fecal occult blood test. Just like there isn't a screening test for pancreatic cancer, there are very few tests where the benefits of screening everyone outweigh the disadvantages. Those include screenings for stomach cancer, colon cancer, breast cancer, and cervical cancer. As for screenings to detect cancers like pancreatic cancer, prostate cancer, or brain tumors, these tests are not covered by public funds, meaning they are not subsidized by local governments. The reason is that even if something is found, the likelihood of it actually being cancer is low, or the side effects of the test themselves can be greater. In other words, there is data showing that for everyone over the age of 40, doing this fecal occult blood test has more benefits than drawbacks. There is data showing that by doing this fecal occult blood test, the risk of death from colon cancer was reduced by 20%. Although it is covered by public funds, only 40% of Japanese people do not undergo this test. Why is that? Among those who test positive in this fecal occult blood test, colon cancer is found in 5 to 10% of them. So what about the rest? About 50% of people are found to have colon polyps, and sometimes blood from hemorrhoids mixes in, causing a positive result in the fecal occult blood test. And just because you have colon cancer doesn't necessarily mean the fecal occult blood test will be positive. In advanced cancer, 80% of people will have a positive fecal occult blood test. In early stage cancer, only about 50% will test positive. When people hear this, they often think, even if the test is positive, only about 5% actually have cancer. And even if you have cancer, it doesn't always show up as positive. So isn't this test kind of meaningless? It's true that 5% might sound low. However, there's some data I'd like to share. When the fecal occult blood test is positive and a colonoscopy is done afterward, half of the people who are found to have colon cancer are at stage 1. In comparison, the symptoms I mentioned earlier, like anemia or thin stools, for people who had symptoms like those and underwent a colonoscopy, only 17% of those who were found to have colon cancer were at stage 1. In other words, by the time symptoms appear, colon cancer has often already progressed. In other words, testing positive for occult blood in the stool is such an important test that it wouldn't be an exaggeration to say it's the only way to detect colon cancer early. Well, actually doctor, I tested positive before, but since I have hemorrhoids I thought it would be fine and didn't get a colonoscopy. There have been people like that, but actually the probability of someone who thinks they have hemorrhoids testing positive on a fecal occult blood test is less than 5%. In other words, even if you think you have hemorrhoids, only 5% of people with hemorrhoids test positive for occult blood in the stool. stool, so if you test positive, you shouldn't just assume it's because of hemorrhoids. You might think it's okay to just take the test again, but even if you take it again and it comes back negative, the result from the first test, a positive result is not always caused by hemorrhoids, so if you test positive even once, I strongly recommend that you undergo a colonoscopy for further examination. And one more thing about polyps, the fecal occult blood test is actually an important test for detecting polyps as well. And how is this related to colon cancer? Actually, 80% of colon cancers develop as polyps gradually grow larger. To explain in more detail, among polyps, there is something called an adenoma. I mentioned that half of the positive results in the fecal occult blood test are due to polyps, but among those polyps, an adenoma is a growth that can gradually enlarge and become colon cancer through a process called malignant transformation. Some do turn cancerous. That's why, when the fecal occult blood test is positive, you should get a colonoscopy. By removing any polyps that need to be taken out at this stage, you can prevent them from turning into cancer. For these reasons, the fecal occult blood test is a very important examination. I explained it in detail and at length, but it's hard to explain this much during a short outpatient visit, so the general public still isn't very familiar with the fecal occult blood test. Even if you understand the fecal occult blood test well, what really worries people is what comes after that. Some people think they don't want to do the fecal occult blood test because a colonoscopy is tough, but actually there are other tests besides colonoscopy. One test I recommend is called a colon computed tomography, which is commonly used in Western countries. This test is also known as a virtual colonoscopy. This test is surprisingly simple. All you have to do is pass through the computed tomography scanner and it reconstructs a 3D image of your colon, just like a colonoscopy inserted from the rectum so you can see inside your colon. This test can detect early polyps just like a colonoscopy, and of course it can also find advanced colon cancer. So even if you don't want to have a colonoscopy, don't just skip the stool test. Since there's also colon computed tomography, please consider the stool occult blood test I mentioned earlier. There are also tests like barium enema, where a contrast agent is put into the colon and x-rays are taken to see through the colon, as well as positron emission tomography, computed tomography scans and others. So please consult with your primary doctor or a gastroenterologist. Now, in the 5th session, I will give a simple and easy to understand explanation of the types of treatments for colon cancer and what kinds of tests are available. When you think of colon cancer treatment, you probably think of surgery, but there are actually many less invasive options. There are treatments where, just like removing a colon polyp, colon cancer can be removed during a colonoscopy. This kind of treatment exists. It's called endoscopic mucosal resection. By inserting the colonoscope through the rectum, if the colon cancer is small, it can be removed just like taking out a polyp. However, in general, this is limited to small colon cancers that are within 2 centimeters, so early detection is very important. And in addition, there's also a procedure called endoscopic submucosal dissection, where during a colonoscopy, only the surface layer of the colon mucosa is cut out to remove the colon cancer. With this method, you can remove colon cancer without making any incisions or holes in the abdomen, and in many cases, hospitalization is only required for about a week. Of course, there are risks involved since it is still a cutting procedure. Additionally, there is a risk of accidentally injuring the colon and causing a perforation. These kinds of complications can occur. So, what options are available if endoscopic mucosal resection or endoscopic submucosal dissection cannot be performed? Besides open abdominal surgery, there is also treatment using a laparoscope. Laparoscopic surgery involves making several small incisions in the abdomen, inserting instruments, and then using those instruments to cut and reconnect the colon. That's the kind of treatment it is. Compared to open surgery, the incisions are much smaller, and from an appearance standpoint, there are no noticeable scars left on the abdomen, which makes patients very happy. Furthermore, blood loss tends to be less, and the average hospital stay is said to be shorter compared to open abdominal surgery. When it's difficult to remove something even with laparoscopic surgery, open abdominal surgery is performed, and treatment isn't limited to just surgery like that. If the cancer has progressed to a certain stage after surgery to remove the tumor, chemotherapy is used to prevent recurrence. If the cancer has advanced further and metastasized to distant organs, surgery is not possible, so we use chemotherapy or radiation therapy to shrink the cancer and aim for a cure. If chemotherapy or radiation works and the cancer shrinks, as a result, there are cases where surgery becomes possible. So please note that using chemotherapy does not mean we are giving up on treatment. And since this is important, please allow me to mention it. That is what we call alternative therapies. Alternative therapies are treatments that deviate from the generally recommended standard therapies. There are various alternative therapies being promoted, and some claim to be more effective than standard treatments. Some even say their cancer completely disappeared. There are such claims out there. However, as a doctor, let me make this clear. There is no solid data or research showing that alternative therapies are more effective than standard treatments. For some people, alternative therapies may have worked. However, in general, based on research, there is no evidence that they are more effective than standard treatments, so please be careful. That said, I don't mean to deny alternative therapies altogether. Rather than only receiving alternative therapies and not undergoing standard treatment, I think one option is to try alternative therapies after receiving standard treatment if you are still interested, and after consulting with your primary doctor. For example, high-dose vitamin C is sometimes recommended for cancer treatment, but actually in some cases it is said that high-dose vitamin C may reduce the effectiveness of chemotherapy. So I am concerned that alternative therapies might end up causing harm. Regarding these points, a detailed explanation can be found in my video about vitamins, so please check it out if you're interested. Now let's review the fifth lesson. For colorectal cancer treatment, the least invasive option is to remove the cancer using a colonoscope. Next, there is a method where small holes are made in the abdomen using a laparoscope to remove the cancer. And finally, there is open surgery where the abdomen is opened to remove the colorectal cancer. I also explained that treatments like chemotherapy and radiation therapy exist. Gaining more knowledge about these options is not necessary. I think it's enough just to have a general understanding that these kinds of options exist. Now finally, let me introduce 2 lifestyle habits that can help reduce the risk of colon cancer, which you've all been waiting for. For those wondering why it's not a list of 5, the truth is that while there are many risk factors, there are actually very few things that have been proven to reduce the risk, so this time I'll introduce 2 carefully selected habits that are supported by data. Here's the first lifestyle habit that may reduce colon cancer risk. It's dietary fiber. You probably know that vegetables are good for your health, but the dietary fiber in vegetables is especially beneficial. Among them, insoluble dietary fiber is said to reduce the risk of colon cancer. Insoluble means fiber that doesn't dissolve in your stomach. To put it a bit bluntly, sometimes you might notice that the fiber from mushrooms, for example, comes out in your stool just as it went in. That's insoluble dietary fiber. Among dietary fibers, these tend to have a somewhat rough texture. Examples are king oyster mushrooms, bamboo shoots, soybeans, spinach, and lettuce. Rather than just thinking, I should eat these because they're healthy, it's important to know why they're beneficial. These dietary fibers help relieve constipation by smoothly moving through your digestive tract, similar to how mushrooms pass through your system unchanged. For example, one cause of constipation is, even if you eat things like red meat, eating vegetables together can help relieve constipation, and as a result it has been suggested that this may lower the risk of colon cancer. One hypothesis about the cause of colon cancer is that constipation causes cancer-causing substances to stay in contact with the colon wall for a longer period of time. Therefore, insoluble dietary fiber that can relieve constipation is thought to reduce the risk of colon cancer. I think the data supports this as a very plausible reason. Now here is the second way to reduce the risk of colon cancer. Exercise. Some of you might be thinking, exercise, huh? It can be hard to incorporate into your daily life, but it's said that even moderate intensity exercise is fine. So, what does moderate intensity exercise mean? It's the kind of exercise where you get a little out of breath, but you can still hold a conversation. For example, jogging or brisk walking where you're a bit winded but can still talk with a friend. But you wouldn't be able to sing or talk for a long time. That's the level of exercise that's considered good. Now let's think about why exercise is beneficial. That's because it helps you lose weight and also relieves constipation. As I mentioned earlier, lack of exercise can lead to constipation and increase the risk of colon cancer. By exercising, the movement of your intestines is stimulated, which relieves constipation and is said to lower the risk of colon cancer. In addition, exercising helps you lose weight. By doing so, people who are overweight actually tend to have a harder time with insulin working effectively. Insulin is the only hormone in our bodies that lowers blood sugar levels. People who have low insulin secretion or whose bodies don't respond well to insulin are the ones who develop diabetes, right? Actually, being overweight makes it harder for insulin to work properly. What's getting attention now is that there is data suggesting insulin may increase the risk of cancer. So, when you exercise and reduce obesity, your body becomes more sensitive to insulin, and the amount of insulin your body needs to secrete decreases. It's said that this might help lower the risk of cancer. Of course, this is just one hypothesis. And something I want you to be careful about is that there are people with diabetes who use insulin injections, but there is no evidence that insulin injections increase the risk of cancer. There is no data supporting that, so please don't worry. How was it? Today, I discussed habits to avoid, lifestyle risks for colon cancer, and initial symptoms to watch for. Colon cancer has no early symptoms, but it's still important to remember the initial signs. I mentioned your stool may thin, you may get constipated, have blood in your stool, or develop anemia. Regarding colon cancer risks, I mentioned red meat, processed meat, lack of exercise, smoking, drinking alcohol, and being overweight as risk factors. It may be difficult to reduce all of these risks, but I recommend trying to do even one thing that you think you can manage. And the most important thing for truly detecting colon cancer early is the fecal occult blood test. You can get this cancer screening covered by your local government, so if you are over 40 years old, please consider getting tested. And finally, to lower the risk of colon cancer, I mentioned insoluble dietary fiber and moderate intensity exercise. Please try these things to stay healthy and live a long life. Thank you for watching this long video until the end. From now on, I will continue to share useful health information in an easy to understand and responsible way, backed by data. If you like this video, please give it a thumbs up. And if you subscribe to the channel so you don't miss the next video, it would really make my efforts worthwhile. See you in the next video.